Welcome to the Ghana Health Information Management System, your integrated hospital system, designed to connect and simplify every process in healthcare delivery. In this tutorial, we'll walk you through the doctor module. You'll learn how to consult with patients, request investigations, prescribe medications, and admit patients within Ghims. The main menus available are consulting room, inpatients, referrals/appointments, and reports. Each menu has specific sub-menus used to perform different doctors' tasks. Under Consulting Room, My Consultations shows a doctor all their assigned patient visit. There's also a variety of consultation lists. Or select Patient Visits to search for a specific patient visit. Under Inpatient, Inpatient List displays all admitted patients in their respective wards. Current Bed State provides an overview of occupied and available beds. Under Referrals and Appointments menu, Referral List Department lists all patient referrals within the department. My Appointments gives doctors access to manage their patient appointments. Theatre List Department displays a department's booked surgical or theatre cases, while Select Appointment provides a search to open specific appointments. Finally, under Reports, the Reports dashboard provides access to the Drug, Medical Item, Consumables Requisitions Dashboard report. To consult for a patient, navigate to My Consultations lists, Inpatients list, or search for a patient visit. Here, you can access sectioned medical details linked to a patient, all under a single, unified record. Each section allows you to either search existing data, or add new entries where needed. The Patient Information section displays the patient's personal and consultation details, including name, age, vitals, and visit details, to ensure accurate patient identification. Under Patient Information, doctors can review key details of the patient's medical record. The Investigations area shows all lab and radiology requests with their current status. The Treatment sheet shows prescribed treatments for medical diagnosis. The Services and Pharmacy Dispenses section tracks drugs and procedures provided during the visit. The Past Medical Records gives access to the patient's previous visits and diagnoses. And Exchange Medical Record allows secure sharing of patient data between connected facilities. In the patient record, the doctor's panel appears on the left side of the Electronic Medical Record, or EMR. This panel organizes all clinical and documentation actions into menus for easy navigation. The Page View menu contains the patient folder, where doctors can access the full patient folder, and a back button to return to the previous page. The OPD menu supports all stages of an outpatient consultation. It includes vital signs, patient complaint, and history taking, investigations requests, diagnosis, management plan, drug prescription, admit patient, finalize visit, and more. The IPD menu shares many items with the OPD, but adds specialized tools like discharge patient, baby form, diet plan, general observation, and more. For critical care areas, the emergency menu includes emergency clerking, emergency triage, and more. Theatre menu items includes operation notes for various procedures such as oophorectomy, appendectomy, and more. Finally, the Documents or Reports menu gives access to all patient documents. A doctor's typical consultation workflow, after checking a patient's vital signs, begins with complaints, medical history, investigation requests, diagnosis, prescribing drugs, or admitting the patient. Click on Presenting Complaints or History Taking under General in the Doctor's panel. Or click Add New above an existing entry to open the initial form. Here, you can enter the Presenting Complaints, History, or select Consult Details under Systemic Inquiry or Examination Findings. Note that a diagnosis and case is required in order to save the form. Select Diagnosis and click Add or Edit Disease to open the form. Enter a disease and double-click to select it. Select a diagnosis type, diagnosis case, or enter a diagnosis detail against the disease. You can add multiple diseases and diagnosis. Once completed, click Apply to save the record. Next, you can enter a management plan for your patient in the input field provided. You can also select an investigation request for either laboratory or radiology tests. These requests will appear in the respective department queues for processing. Select an investigation, click on Add or Edit Investigation to open the form. Enter a type of investigation and double-click to select it. Enter any clinical detail against the investigation selected. You can add multiple investigations and clinical details. Once completed, click Apply to save the record. Next, to prescribe drugs, select Add or Edit Medical Items or Consumables to open the form. Enter a medical item or drug, and double-click to select it. Enter any dosage, route, frequency, and other details against the drugs or medical item selected. You can add multiple medical items and drugs to the list. Once completed, click Apply to save the record. These details are transmitted to the pharmacy module, where dispensing staff can prepare and issue medications. You can select the Add or Edit Services or Procedures to request a procedure or service for the patient, following similar steps as shown before. Once the Presenting Complaints form is completed to your satisfaction, click on the Save button. The captured form details will then be added to the patient's electronic medical record. When admission is needed, the doctor uses the Admit Patient form. This initiates admission and inpatient care process. Select a ward and bed to open the admission form. Enter the required details marked by the red asterisk, such as the admission type. Once completed, click Save. The system will display the prompt, "One record saved," confirming it saved successfully. The patient will now be placed on a waiting list to be assigned a bed by an IPD nurse. After all actions are completed, the doctor can close the visit by clicking on the Finalize Visit option to open the form. Enter the form details, such as medical outcome and doctor's summary. Once completed, click Save. This marks the consultation visit as complete and updates the patient record for billing and reporting. This concludes the tutorial on the Doctor's module in Ghims. Thank you for watching. The Ghana Health Information Management System, transforming healthcare management with tools to deliver exceptional care with confidence.